students, welcome to Rguhs Salt Papers. Today we are discussing April 2023 paper 1. We are discussing short answers. The short answer means that is a 3 marks question. So I am going to discuss all 10 questions in 30 minutes. So I am going to discuss the specific answer and some applied biochemistry aspects. Let's start. Question number 11. Explain the structure of collagen. What is collagen? The collagen, it's a very important component of bone, tendon. It acts as a glue. The literal meaning of collagen is glue. So, what is the structure of collagen? The collagen is made up of 3 polypeptide chain. Polypeptide chain. So it is nothing but alpha helix. What are the important amino acids present in collagen? Your answer should be glycine, proline, and hydroxyproline. Let's see here. So this is the structure of collagen. What you can see here, this is the hydroxyproline, proline and the glycine. You can see here, right? Let's see in detail about it. The collagen synthesis is very important topic. You must know what is pre-pro-collagen, pro-collagen, trophocollagen and collagen fibril. See here the collagen synthesis, translation that occur in the ribosome. As you know, translation means protein synthesis from amino acids, and there is a hydroxylation of proline and lysine which forms pre-pro collagen in endoplasmic reticulum. From endoplasmic reticulum are released from the ribosome, it undergo glycosylation. So that is known as procollagen in the cytosol. Then there is a formation of triple helix formation, that is a alpha helix. Then that is nothing but procollagen, secretion from the cell, and in the extracellular space, the removal of N and C terminal domain, so that becomes tropocollagen. And tropocollagen, then there is a cross-link formation that forms the collagen fibril. So pre-procollagen, procollagen, trophocollagen, and finally cross-link formation forming collagen fibril. Then one important question asked in your exam: what are the main collagen types? So there are many types. One most common type is type 1. What is the category? That is the fibrillar collagen. Where it is present in the bone, present in the skin, tendon, ligaments, cornea, fibrous cartilage, connective tissue, teeth, and that is muscle. Type 2, that is present in again fibrillar, present in the cartilage. The strongest is the type 1. So the type 2 present, that is the cartilage, vitreous body, nucleus pulposus. Type 3, that is the fibrillar collagen, present in the blood vessel, intestine, muscle, reticular fibers. And the type 4, remember, type 4 present in basement membrane. This is very important question. Basement membrane, type 4. And other types, type 5, type 11, 9 and all, you can go through the notes given to you. So basement membrane, type 4, the most common, type 1. Now one or two points about the applied biochemistry. What are two conditions in which collagen synthesis is affected? One is osteogenesis imperfecta. Second one is Ehlers-Danlos syndrome. Look at this. Can I identify this A and B? A and B. The picture A, that is osteogenesis imperfecta because of defective collagen. Osteogenesis imperfecta. And this is Ehlers-Danlos syndrome. So what you can see here in this picture, hyperelasticity. Hyperelasticity and hypermobility are the features of Ehlers-Danlos syndrome. This is about question number 1. We need to complete each question in 3 minutes. Next, biomarkers in MI. What is MI? That is nothing but myocardial infarction leading to ventricular fibrillation and death. So the many celebrities, they die due to MI at their young age, recent days. So probably because of the lifestyle. So let's see what are the biomarkers in MI. So what happens in your plasma? What are the markers actually? So one thing you should answer: troponin, troponin I and troponin T. Then creatinine kinase, that is CPK2, myoglobin, lactate dehydrogenase. So what are the four? First one is the troponin I and troponin T. Which is important? I is important. You can remember I for important troponin. When it is going to rise? 3 to 12 hours. Peak level time 24 hours. Fall to normal 2 weeks. Creatinine kinase, especially CPK2, that rises within 3 to 12 hours. Then peak level in 24 hours. Fall to normal in 48 to 72 hours. So you can see here creatinine kinase level comes to normal within 3 days. So after 3 days, if any reinfarction, you can use CPK2. Lactate dehydrogenase after 24 hours, 36 to 48 hours is the peak level time. 14 days, 2 weeks. So that is for the time for fall to normal. The last one, myoglobin, within few hours it is the first thing going to rise, myoglobin. But myoglobin, it is non-specific. It rises in many conditions. Okay, even in muscle damage, muscle dystrophy also there can be increased myoglobin. So within 24 hours, it fall to normal. So this is about a biomarker of MI. And one more question asked in exam: what are the ECG changes in MI? If you are a student, you should remember ST segment elevation. What is the finding? ST segment elevation, very important finding. Then pathological Q wave, inverted T wave. So these are all important ECG changes. So timing, remember ST elevation. Okay, tomb appearance, that is the death tomb appearance. So that is the ECG finding along with pathological Q wave, inverted T wave. Next, question number 13. Functions of vitamin causing scurvy. So here the question is about scurvy. What is the vitamin? Scurvy is a clinical condition. So that is due to deficiency of vitamin C. So what is the question asked here? The question asked here is vitamin C. What are the functions of vitamin C? Very simple. Collagen synthesis. Yes, there are many functions are there. You can remember the mnemonic ascorbate. Okay. What is A for? A for antioxidant. So vitamin C is a well-known antioxidant. Ascorbate is a mnemonic. A for antioxidant. S for steroid hormone synthesis. Steroid hormone synthesis. Collagen synthesis. Oxidation reduction reactions. Detoxification. Bone formation. Absorption of iron. Metabolism of tyrosine and tryptophan. Enzyme activation and enzyme inhibition. So there are many functions of vitamin C. The one very important function is antioxidant. It's a well-known antioxidant. Second thing, collagen synthesis. So when collagen synthesis is affected, that leads to bleeding and other manifestation known as scurvy. And one more, steroid hormone synthesis. And one more point you must know, scurvy, what are the clinical features? You can remember with the help of mnemonic 4H. 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 H for what? Hemorrhage. So there can be bleeding tendencies from the gum. There can be petechiae, bleeding gums. So one H is hemorrhage, bleeding gums. Or it can be petechiae over the body. Petechiae means small hemorrhages over the body. Hyperkeratosis. Hyperkeratosis, rough skin, loose teeth, poor wound healing. In the wound healing, we require vitamin C that is affected in scurvy. Hypochondrosis, there can be emotional changes, irritability, then hematological abnormalities, easy bruising. So easy bruising and minor trauma is a feature of scurvy also. So all these are, you can remember, the mnemonic is ascorbate and 4H is the mnemonic of scurvy. So 4D we discussed yesterday, that is for niacin deficiency. Next, question number 14. Name 3 mucopolysaccharide and its function. It is very important question, very commonly asked in the exam. What is mucopolysaccharide? The mucopolysaccharide is a glycosaminoglycan. Okay, so there are homopolysaccharide, heteropolysaccharide. So these mucopolysaccharides are heteropolysaccharide. So let's see what are important one. So one is hyaluronic acid. Okay, hyaluronic acid. Where is this present? This is present in the joints. Present in the joints, acts as a lubricant. Present in the vitreous humor for consistency, and also present in the tendon and the cartilage. What it contains? D-glucuronic acid, N-acetyl glucosamine, N-acetyl glucosamine. Chondroitin sulfate, again it consists of D-glucuronic acid and acetyl galactosamine 4 sulfate. It is very important in giving tensile strength of the tendon. Dermaton sulfate, made up of L-iduronic acid, N-acetyl galactosamine 4 sulfate. It is for pliability of the skin. Then the heparin. What is the function of heparin? Heparin is a well-known anticoagulant. So it is made up of N-sulfoglucosamine, 6-sulfate, glucuronate 2-sulfate, which is a well-known anticoagulant. Last one, keratin sulfate. Remember, keratin sulfate present in your cornea. That is because that leads to transparency of the cornea. Made up of D-galactose, N-acetyl glucosamine 6-sulfate, keeps your cornea transparent. In cornea, keratin sulfate. Your joint, hyaluronic acid. Heparin is an anticoagulant. If you write 3 with 3 important function, you will get 3 out of 3. But remember, if it is asked for the 5 marks question, you need to add some applied biochemistry. What are mucopolysaccharidosis? So your answer should be, Hunter syndrome, Hurler syndrome. So there are many syndrome, they are nothing but defective mucopolysaccharide synthesis and the deposition. Can you look at this condition? So there is a picture, the picture of a child suffering from mucopolysaccharidosis. What is that? So you can see the frontal bossing, you can see the hypertrophy of the gingiva. So all this go in favor of something known as Hurler syndrome. So what is Hurler syndrome? Frontal bossing, hypertelorism, gaped teeth, short neck, mental retardation, cornea clouding, depressed nasal bridge, hepatosplenomegaly. In Hunter syndrome, there is no corneal clouding. Hunter eye should be very good. So cornea clouding is absent in Hunter syndrome, present in Hurler syndrome. So this table is given in your notes. You can go through this. Hurler, Hunter, San Filippo, Marchio, Lamy syndrome. All this you need to remember. Sometimes I can ask you 5 marks question. What is the applied biochemistry of heteropolysaccharides? Or heteropolysaccharides are mucopolysaccharides? So I need to complete each question in 3 minutes. So we discussed important points. Question number 15. Name 3 phospholipids and its function. See, phospholipid, they are present in many sites. One important site is your surfactant. The surfactant is made up of phospholipid. Deficiency of surfactant leads to hyaline membrane disease. Okay, that leads to respiratory syndrome, distress syndrome, and death of the child. So one is surfactant. Second thing, it is present in the all the cell membrane. It is for the permeability of the membrane. Permeability. Okay, permeability, which has a hydrophilic and hydrophobic layer. So hydrophilic head, hydrophobic tail. So which is basically for permeability of the membrane. Also for the absorption of the fat from the intestine. VLDL, LDL, HDL, all these are nothing but phospholipids containing compounds. Electron transport chain, especially lecithin, cardiolipin, and cephalin. So this you need to mention. They are present in the they are the phospholipid present in electron transport chain. Then phospholipid also for the metabolism and also to prevent the fatty liver. Yesterday question, fatty liver we discussed. The last one is the surfactant. So what the surfactant contain? It contains dipalmitoyl phosphatidylcholine. Okay, so that is the very important phospholipid present in the surfactant. And deficiency causes what? Hyaline membrane disease. Hyaline membrane disease. Okay. Question number 16. What is hypokalemia and what are the causes? Hypokalemia means decreased levels of potassium due to various causes. What is normal level? Normal level of potassium is 3.5 to 5.5. What is normal calcium level? 9 to 11 we discussed in our classes. So hypokalemia. So what is hypokalemia? When the level is less than 3.5. Remember, hypo and hyperkalemia, they lead to cardiac arrhythmias. So we need to maintain potassium level at the level 3.5 to 5.5. So what are the conditions leads to hypokalemia? One condition is the vomiting, diarrhea, GIT, fistula, diuretic therapy. So remember, that's why in vomiting, in diarrhea, we give ORS. One of the very important component of ORS is the potassium. So vomiting, diarrhea, GIT, fistula, diuretic therapy, or there can be increased aldosterone. So primary aldosteronism or the tumor of adrenal gland. So when it secretes more and more aldosterone, there is a more and more absorption of the sodium. So potassium goes out. So that leads to potassium loss. So what are the clinical manifestations? muscle weakness, nausea, anorexia, dizziness, leg cramps, cardiac arrhythmia. So one very important finding clinically, that is the cardiac arrhythmias, hypotension, polyuria, and poor concentrated urine. So if you write this, you will get 3 out of 3. And dear student, you must know one more important finding, ECG finding in case of hypokalemia. So what is the ECG finding in hypokalemia? There will be ST segment depression. ST segment depression. Now, next question, very simple question. Define Km value, Michaelis Menten constant, and its importance. It's a very simple question. What is Km value? Km value is the substance concentration at which the Vmax level is half. That is the half of the Vmax value. You can see here Michaelis Menten constant refers to concentration of the substrate at which reaction reaches half of its velocity, that is the maximum velocity, that is the Vmax. It was first explained by Michaelis and Menten in 1913. So what is the importance of Km value? The Km value important is affinity. No, Km value is inversely proportional to affinity. So when Km value is high, that means affinity is less. When Km value is low, that means affinity for the substrate that is related with the enzyme, it is very high. So that is the meaning of Km value and also relation with the affinity. Look at this. You need to write this picture in exam. So this is the substrate concentration on x-axis, y-axis Vmax. So this is the Vmax and this is the half Vmax, half of the Vmax, and this is the substrate concentration. So this is nothing but your Km value. And here also you can write here one more picture in the exam. Enzyme B with the high Km value. That means it is low affinity. Enzyme A has a low Km value, that means high affinity. High affinity. Question number 18. Role of carnitine in beta oxidation. So what is the function of carnitine? So carnitine shuttle, something known as carnitine shuttle in biochemistry. The carnitine helps in transport of amino, that is the fatty acids. So long chain fatty acids from cytosol into the mitochondria. Let's see what is carnitine. Carnitine is beta hydroxy gamma trimethyl ammonium butyrate. That is carnitine. So what is this basically? Hydrophilic quaternary amine. It's a hydrophilic quaternary amine. The main function is transfer of long chain fatty acids to mitochondria for beta oxidation. Look at this picture. So this is the cytosol and this is the mitochondria. Yeah, this is fatty acyl CoA, which is converted into CoA with the help of carnitine acyl transferase 1, where carnitine is converted into fatty acyl carnitine. It's a quaternary amine. So from cytosol it enters the mitochondria. In mitochondria, this fatty acyl carnitine metabolized to carnitine or converted to carnitine. With the help of carnitine acyl transferase 2. So again, there is a formation of fatty acyl CoA. So this is the function of carnitine. If you write this picture along with 1 or 2 points, you will get 3 out of 3. Question number 19. Biological importance of selenium, which is 21st amino acid discussed in our classes, selenocysteine. 22nd amino acid, pyrrolysine. What is the biological importance of selenium? The one very important function is antioxidant. So it acts as an antioxidant. It also acts as an anti-carcinogenic agent. It also important in reproduction, brain development, immunological function, so many functions. Some functions you need to write in exam. One is the regulation of, that is the immunity function. You know, plasma cell, B lymphocyte, T lymphocyte. So the function of these lymphocytes, so they require some amount of selenium. Second, brain. So it protects the brain from free radicals. It acts as an antioxidant. It also helps in thyroid hormone synthesis and also the function of thyroid hormones. Anti-mutagenic effect. Anti-mutagenic means it is against the mutation. A mutation leads to what? Cancers. It has an anti-mutagenic effect. Lastly, reproduction. Improving conception, integrity of sperm membrane and fertilizing ability. So deficiency of selenium can lead to infertility or oligospermia also. So if you mention at least some 4 to 5 function, that is more than enough in your exam. Then the last question. Define active transport with example. Active transport, what do you mean by active transport? Active means there is a ATP involvement, right? So active transport is a type of transport where movement of molecules from the region of low concentration to the region of high concentration against the concentration gradient with the use of external energy. What is external energy? That is nothing but ATP. You can see here. Okay. Again, there are two types: primary active transport, secondary active transport. One example for primary active transport: sodium, potassium, antipode. As you know, sodium is a extracellular positive ion, potassium is intracellular positive ion. Sodium potassium antipode are proton pump in stomach, proton pump in stomach, or the calcium pump. So all are the examples. Here what you can see here, primary active transport and the secondary active transport. Example, sodium and potassium. So that is sodium goes out, potassium comes in with help of ATP. Secondary active transport, one example is symport, the symport of sodium and glucose. Sodium and glucose. So this property is used in ORS powder. Okay. So differences also you must know. What is the difference between primary active transport and secondary active transport? So that is given in your notes. Try to remember what are the examples. Examples of primary active transport: sodium potassium pump, calcium pump in the muscles, proton pump in the stomach. What are secondary example? Glucose sodium pump, sodium calcium exchanger, and sodium phosphate co-transporter are the examples. So this is very important example you need to remember. Sometime they'll ask you what is secondary active transport with example. You need to write the examples also. So that's it about the today's discussion. We discussed 10 questions in 30 minutes. The time is a limiting factor in any exam preparation. I hope you are solving all previous year questions and also doing some very good preparation, and be positive all the time. Around 50 plus days are there for your upcoming Rguhs exam. So all the best. Thank you.